We have a special guest, Dr. Harry Fisch, who is professor of urology at Columbia Presbyterian Medical Center here in New York, and he has a brand new book called The Male Biological Clock. And Harry, I got to tell you, my biological clock is ticking. So what is this male menopause? What is it all about?
Well, you know, it's interesting. We always think of women as they have a decline in their fertility, a decline in their hormones, and the genetic consequences of having children as they get older. Well, believe it or not, the same thing is happening for men. As men get older, there's a decline in fertility, a decline in their hormones, and an increased chance of having babies with genetic abnormalities because the DNA of sperm changes as well. But some of the things that's very interesting is that, you know, we think as men get older, they're 80 and whatever, and they can do the same things that they could do in their 40s. That's not true.
Harry, can we prevent this menopause in men from happening?
Yeah, well, it's not a menopause exactly. It's something called andropause, or it's a decline in hormones as we age. It declines a little bit on a slope. It doesn't come down like it would in women sometimes with their estrogen levels, but we can help it a lot. And the thing that we could really do best, and you've heard this before, I'm sure a million times, is diet and exercise. It turns out, and this is what's really interesting about my book, The Male Biological Clock, is that men who have abdominal fat, visceral fat, belly fat, pot bellies, whatever you want to call it, have a lower testosterone than men that don't. So if over the years you've gained inches on your waist, you are likely to have a lower testosterone and may be at risk of having symptoms associated with low testosterone.
Now, a lot of people are concerned about testosterone and the side effects, whether it's prostate cancer, or also we hear that testosterone has been linked to heart disease. What do you think about that? Well,
absolutely true. There's been a lot of work done on testosterone, excessive testosterone, such as anabolic steroids. You know, these athletes take all these things, and you hear about some of the real problems that they have, but they take testosterone levels that are way high. We're looking at people who have below normal testosterone levels, and we just bring it back to the normal amount.
Okay.
In the normal amount, you're not seeing side effects, you're seeing beneficial effects.
Okay, thank you so much, Dr. Fisch, for coming with us this morning. Thank you, Harry.
My pleasure.